Okay, so good evening and welcome everyone to Protexin Veterinary's webinar, Periodontal Disease, the Silent Pain Epidemic. So we have part one tonight of two sessions hosted by Dr. Bonello. So regarding the format of tonight's session, so I'm going to give quick introductions, a little bit of an explanation of what we're doing here tonight. Then Dr. Bonello will speak for about 45, 50 minutes, that neck of the woods, and then we'll have questions at the end. So we'll have time for some questions. You'll notice at the bottom of the screen, there's a Q&A box. Although we'll answer the questions at the end, if anything pops up as we're going through that you want to ask into that box at that time, you can do, and then we'll go through as many questions as we can at the end. So initially, I'll just introduce myself. So for anyone I don't know, I'm Jill McMaster. I'm one of the vet team at Protexin. So we have about 10 vets in our team. So if you ever get in touch with a technical query, we're always happy to help out. And it'll be myself or one of my colleagues that help you out. So what we're doing here tonight, a couple of reasons. The first one is we're currently celebrating our launch of our new product. So I don't know if you can see it there. This is our Plaque Ease product. It's a pre and postbiotic dental powder. It's for dogs and for cats. It's helping control plaque, managing tartar buildup, reducing bad breath, and supporting a healthy oral microbiome. So we might not have it everywhere just yet if you're joining us from outside the UK, but we are doing our best to get it worldwide so everybody can get their pets benefiting from it. So the main kind of reason we're along here tonight is because we're talking obviously about the Plaque Ease, but also in general, it's a really good time, I think, to have a good chat about dental health. So we've got a team of vets, as I said, and vet nurses as well on board, and we all think it's really important to provide support for veterinary staff and good CPD and webinars that actually can really help them in their general practice and in the work they do day to day. So if we can improve, our abilities as healthcare professionals, that's going to benefit pets worldwide. So I know from me personally, from a lot of colleagues, a lot of us learned our dentistry skills on the job. Can be great. You can have fantastic colleagues. You can learn some really good stuff. But I think it can be really, really helpful to have this information from a dental specialist. And that's where Dr. Bonello is coming along to help us with tonight. So I'm really sure that this session will help us to improve the dental care of our patients. And as a result, as we know, we want to improve these pets' well-being as a whole, and dentistry is so important for that. So to give Dr. Bonello, her proper introduction, Dr. Bonello graduated from the Faculty of Veterinary Medicine at the University of Turin. She also obtained a diploma of specialism in veterinary radiology and a PhD in veterinary internal medicine. So after completing her alternate residency programme under the guidance of Professor Frank Vestrate, head of Department of Dentistry at the University of California, Davis, she became a diplomat of the European College of Veterinary Dentistry. So Dr. Bonello worked in private practice as a specialist in dentistry, consulting for both small and large animals, and in 2016, she established the first veterinary dental practice in Italy. So she has served as president of the European Veterinary Dental College and of the Italian Society of Small Animal Veterinarians. So in 2022, Dr. Bonello relocated to Hong Kong to establish the dentistry and oral surgery department at City U Veterinary Medical Centre, and she's currently the head of the dentistry and oral surgery service at Harvest Veterinary Specialty and Emergency Hospital. So Dr. Bonello has been a speaker at various veterinary meetings in Italy and abroad, and has authored publications on veterinary and comparative stomatology. So I'll pass over to Dr. Bonello.
Thank you, Jill. Thank you very much for the kind introduction, and welcome to everybody. Thank you to all of you for giving your time to follow this conversation about veterinary dentistry, and it's focused mainly on what does it mean to try to develop veterinary medicine, veterinary dentistry in our daily practice. And I try to put in that all my experience, that is quite a bit, I would say. And this is the topic that I really care the most about. Periodontal disease, also because it's the most common disease that we find in our pets. And I really do think that is absolutely underestimated. So I will talk about the prevalence, the impact of periodontal disease. I will talk a little bit about the pain that comes from this disease and the dental pain pathways and how we evaluate the pain. I will talk a little bit about how to manage the pain, and the professional dental cleaning is a very important part of that management. And then a little bit about preventive measures and owner education. I'm not sure I will follow this order, but I will try to cover all these topics. So let's start from the very beginning. Periodontal medicine is what we refer to nowadays. Now, periodontal disease have been, classified and reclassified, and the etiology has been investigated, and many different theories have been proposed during the years. So what we know today, what we think today, is that we should stop to look at the oral cavity, and specifically of periodontal disease, like something that is restricted to that specific area. Okay, is like how things changes. At the beginning we were all vets, and then specialty came, and then there were specialists, and now we are discussing again if being a specialist is enough, or we should look at the organism as a whole. So periodontal disease is a multifactorial, infection-driven inflammatory condition. So basically, it's an inflammatory disease that is initiated by the bacteria that are in the plaque, but it is exacerbated by the host immune and inflammatory response. The most important part, and the reason why it's now called periodontal medicine, is that periodontal infection and inflammation both influence and are influenced by systemic conditions and diseases. Okay, so everything starts with a healthy gingiva, even if honestly, from a physiological point of view, healthy gingiva does not exist, because it is an ecosystem where we have tissues, but we also have bacteria, and they live in a saprophytic condition, but still some inflammation is present there, even in what we define as a healthy condition. But just to be clear, a healthy gingiva, it is pink or pigmented, of course. It is firm, and there is no bleeding when there is brushing or chewing or any other activity that our dogs or cats do with their mouth. Then the first stage of periodontal disease is the gingivitis. It is a reversible condition. That means that we can cure this condition, okay? It is an inflammation of the gums, and as I was saying before, is caused by the plaque that builds up because basically they don't brush their teeth. And we can appreciate redness, swelling, and bleeding on brushing. Dentists, we like to say bleeding on probing. That means that when you touch the gums, they can bleed. So redness and swelling basically are symptoms of inflammation. Okay, so it is a generic inflammation. There is no irreversible tissue damage. And then this condition, if untreated, progresses into an early periodontitis. Periodontitis, it is irreversible. It means that the damage that is caused by the disease cannot be cured to return to a healthy, anatomically whole gingiva. So we can treat the condition and the gums can heal, but with a scar. Because we have what's so-called attachment loss. That is basically the formation of the periodontal pockets. In some rare occasion, we can have gingival retraction as well. Gingival retraction is more common in people, but I put here an example of early gingival retraction as well. And then again, there is a progression, and the progression is caused by the disruption of the so-called junctional epithelium, that is the tissue that is at the bottom of the gingival sulcus. So the gingival sulcus is the seal that isolates the crown of the tooth that is in the mouth, so it's exposed from the other tissues, the root, the periodontal ligament, the bone, that should not be exposed in the oral cavity. Okay, that's the role of the gingiva. But all this responsibility lays on a few layers of cells that are positioned at the bottom of the gingival sulcus. It's strong, but it's fragile at the same time. And when this situation, this seal is disrupted, it cannot be put back. Okay, so we can have a scar there, but we will not have a healthy gingiva and a healthy gingival sulcus anymore. And that scar is fragile. Okay, it's like when you have a tear in a muscle and it heals, but it heals with a scar and it will keep on breaking up in the same point. So when we have the progression of these bacteria in apical direction, that means toward the apex of the root, we have the formation of a periodontal pocket. A periodontal pocket is a pathologically deepened gingival sulcus, okay? Instead of having a normal depth of the gingival sulcus, we will go in with a probe and we will see that is deeper, okay? Because we use a probe to measure the depth of the periodontal pocket, okay? It can also be visible in your imaging, even if you have X-rays or a CBCT scanning, and I will show a few of those. What it is really, really important from a diagnostic point of view, but also for treatment planning, is not really the depth of the pocket, but is the amount of attachment loss. And this is a little bit technical, but of course, if you have gingival retraction, like in this case, okay, so this is the point where you start measuring, because this is the bottom of the gingival sulcus. It's called cement enamel junction. So if you have gingival retraction and you measure this pocket, that is not the real attachment loss, because the attachment loss measure is the depth of this pocket plus the gingival recession. At the same time, like in here, if you have gingival enlargement, or what we call gingival hyperplasia, then it will be a pseudo pocket. Maybe you will measure a pocket that is not really attachment loss. Okay. The final stage of the periodontitis is called advanced periodontitis or severe periodontitis, is when the attachment loss is so significant that the tooth loses stability and we can lose the tooth. Okay, so this is an example. This is a tooth that has 3 roots, and one is still, you know, showing some kind of tissue that is alive, and the other 2 roots are not. This is the mechanism that leads to the loss of a tooth. So we have an initial stage that is reversible, and then after that, early periodontitis, advanced periodontitis, they are irreversible. That's why when we talk about periodontal medicine, or in general about teeth health, we talk about prevention. Okay, prevention is a concept that should not be misunderstood, because sometimes we talk about prevention when we talk about cancer, but we cannot really prevent cancer, okay? We can diagnose early, we can have healthy habits, but we cannot prevent cancer. But we can prevent tooth loss. We can prevent severe periodontal disease. We can prevent periodontal disease even in the early stage, and we will talk about that. So prevention should be our first goal, because it means to prioritize the well-being of the patient and reducing the risk of the disease, of the pain, and of long surgeries, also costly surgeries. So I really do think that talking about dentistry prevention is part of our ethical obligation. So the question, now I have a question, okay? The question is, how can we let this happen? These are all cases, okay, that I've seen at some point, in all terrible situation, mostly old dogs. And at that point, the only thing that you can do is extract, but it's too late even for that. And I will tell you why. So another question that I have is, and of course I don't want you to answer, but I would like you to think about that. When you see something like that, do you investigate, and then do you recommend treatment? I know that the answer is yes. But then the question is, when you see something like this, that is the early stage of a disease, like the picture that I showed you before, do you recommend treatment with the same emphasis and the same ability of explaining what's going on and why it is necessary? So there are many reasons why that happens, okay? Because periodontal disease is one of the most overlooked and seldom treated condition. So let's talk about us, okay? Why? Because I think that the responsibility is ours. First is ours. So let's say that it's difficult. It's not always easy to perform a comprehensive oral examination in patients. Some patients don't allow it at all. Some others, yeah, maybe being really careful, but you cannot really perform a comprehensive oral examination. And then you know that you would need sedation or general anesthesia, but that complicates things and that's one point. The other point, and this is my conviction, after 36 years of career in veterinary dentistry, there is still a gigantic lack of education at university. Because if you think that in human medicine, dentistry is 5 years, is a master degree, and then there are specialties after that, and we do what? Probably 1 week. I don't think we do even 40 hours in 5 years of university, without talking about, you know, the practical part. And that leads, in my opinion, to a lack of knowledge that leads to ineffective communication. Because to explain things, you need to have a very clear idea of what you're talking about. Then there is another problem, that is lack of equipment. In many practices, there is really basic equipment, and the vet that have to deal with cohort and extractions feel really uncomfortable doing those procedures because it's long and it's messy and it's difficult. And also, and that is another thing that we should really consider, when we prescribe medication, when we diagnose some kind of dental issue and then we prescribe medication, they work, especially antibiotics. That's what we prescribe usually, amoxicillin, and they work. And we didn't fix anything really. We did a symptomatic treatment of something that is going to recur pretty quickly, but also induces the owner thinking that somehow the problem is fixed. Okay. And then there is the owner side. The biggest problem is that we cannot measure the pain, and pets rarely show symptoms until the condition becomes really bad and severe. So the owner are not able to understand what's going on. The owner are not able to look in the oral cavity and you know, make a diagnosis. So when I say ignorance, I mean in the Greek assumption of the word, not knowing. And in the end, they shouldn't be the one knowing. Then they are scared, usually, about the idea of general anesthesia. This is such an archaic thought, but it's still there, it's still out there. And the owner that do pay attention and, for example, brush teeth, the risk is that they fall in what is called the prevention paradox. That means that they think that they do whatever it's necessary and so they don't need to do anything else. And last but not least, it's expensive. So sometimes that is the problem. But if we treat this condition at the very early stage, it's not going to be expensive. And it's quick and it's not painful. Let's see how. Okay? But just to stress again, for an owner, these symptoms are really easy to understand. Okay? And so they come in. They walk into your waiting room and they ask for your help because they noticed that something was wrong. But our pets, they eat even if they are painful. And so this is the main reason owners don't think that there is a problem there. But on the pet side, they eat because they are driven by a survival instinct. And because they have a completely different resilience to pain that is also related to the survival instinct. On top of that, of course, what is a great predisposing factor is that there is a complete absence of adequate oral hygiene because mainly of the diet texture. And a little bit because they really don't like, when the owner tried to brush their teeth, especially the cat. But these are carnivores that should hunt, kill, and eat their prey. And there is nothing in a bowl full of kibbles that resemble a prey. And that's the reason those teeth that are made to kill and chew on rabbits or rats are not properly clean by the type of diet that our pets receive in our homes. So the end result is undiagnosed periodontal disease. And it's so difficult to sometimes, even for me, and to explain to owner that they are painful in a different way. Okay, yeah, a cat with stomatitis screams sometimes. A dog with a terrible mouth, like I showed you before, does not. And most of time eats. So there is this study that I think it will open the path for many others and probably for objective way of measuring this kind of pain that shows how the majority of pets, 90% is almost all of them, pets with periodontal disease that show no signs of pain or discomfort yet exhibit elevated serum substance P, that is the pain neuropeptide. And because they did also a scale that was based on behavior, avoidance behavior. Why? Because pain is a really complex reaction of our body and mind. So it is defined, and I like this definition, please forgive me, as a sensory and emotional experience that is associated with actual or potential tissue damage and is accompanied by the stimulation of specific nerves that have pain receptors, of course. Otherwise, we cannot feel the pain. So let's dig a little bit into that. To make a long story short, there are billions of pain receptors, both in the periodontal tissues and in the teeth. But the periodontal nociceptors are primarily A delta fibers that are those that signal fast, sharp pain. So super painful, okay? And these signals are collected by the various different branches of the trigeminal nerve that enters the skull more or less here, whether the oval foramen is, just, you know, medial to the bulla. And there is the ganglion immediately after the oval foramen, and there is the brain immediately there. Now, the thing that the pathway is so short makes the pain more acute and intense. But it's only one part, okay? Because then when the pain, the pain stimulus reaches the brain, it reaches many different areas of the brain, included the prefrontal cortex. That's the one that is responsible for the cognitive reaction to the stimulus. Okay, and that's why behavioral changes. So there are really thousands of studies in human medicine on pain, because it's well known that pain, especially chronic pain, can affect health and well-being, not only through, you know, cognitive and affective processes, also through biochemistry that conditions the tissues and not only the perceptions. And it provokes passive or avoidant coping strategies. When we are in pain, we don't go to the pub. We don't go to the disco. Probably we stay at home and the lights are down and we lay on the couch and we wait. We take something, of course, and we wait for the pain to go. This is what they do. They become sleepy. They are less interactive. Okay, funny story. I did a very intensive and extensive periodontal treatment that was almost a full mouth extraction in this Maltese dog many, many, many years ago. And then usually I recall my patient after 1 week to check on the wounds, and then after 3 weeks to check on the ability of the owner to maintain a proper oral hygiene. And then I recommend every 6 months of every year, just to stop by, have a chat, have a look. And after 3 weeks, the lady came back with the dog and told me, oh, you know what? I think that you did not only fix the teeth problem, you also fixed the back problem. And I said, sorry, what do you mean? Oh, because he has always had these back problems, and because was not climbing the stairs anymore, because when was young, he used to go upstairs and wake the kids up in their bedrooms, but now it was kind of more than a couple of years that was not doing so, and the vet said that there was this back pain, and so probably the dog was still under the effect of the pain medication, but for sure, by relieving some of the pain, the dog was feeling like, you know, willing to live again and enjoy life again. Because the problem with tooth pain is that it doesn't end there. And if any one of you have ever had this kind of experience, that I don't really wish to any of you, tooth pain comes with attachments. And these are hyperalgesia, that is the increased perception of pain or an extreme sensitivity to pain. That means that even a very mild, gentle stimulus, it causes an abnormal reaction, okay? So you feel it as much more painful that it is. And also that's typical of teeth, the so-called referred pain. That means that when you have toothache, you cannot really identify the tooth that's the cause of the problem. So when the dentist asks you which one is, you can sometimes say, oh, it's up here on the right. But sometimes you feel it also low on the right because it's irradiating pain. And then in the chronic condition, a component that is always there is the neuropathic pain. Because by being triggered month after month, year after year, the nerve fibers themselves get inflamed in a chronic, sometimes irreversible way. And that kind of pain is terrible, because is really typical. If you talk to people that experience that, it feels like kind of burning, tingling, electric shock sensation. Probably is what is a component of the feline stomatitis type of pain. So there are many medication. I'm not going through these. Each and every one of you has its favorite ones, depending on also of the general condition of the patient. But please pay attention to pain medication. When you do a consultation, waiting for surgery, after surgery is a super important part, because it helps the patient recover really faster. So a few tips. So we just change a little bit. Number one, teeth and periodontal disease tissues cannot repair damage. Okay? So that's why we need to recognize and treat the early stage of the disease to prevent its progression. The early stage of the disease is the gingivitis, is not the early periodontitis. That's the difficult part. But I hope this can help. Halitosis is a symptom, okay? Bad breath is a symptoms of damage or potential damage, because the hydrogen sulfide that is produced by the bacteria, certain bacteria that are in the biofilm of the plaque, in the gingival sulcus, they are super harmful. So halitosis is a way of grading and scoring the extent of the periodontal disease. Tooth loss. Tooth loss is one of the criteria to diagnose a severe or advanced periodontitis. Okay? So if a dog's come to you and the owner says, oh, he lost just one small tooth in the front, you immediately know that you are dealing with an advanced periodontitis. Because there is a pattern that's called incisors molars. And if you start looking at things in that way, you will see that it is, it is true, that the same kind of severity of the condition that's affecting the incisors is affecting the molars. Okay? So if a dog lost one incisors, you have to hurry up and go and have a proper look in the back of the mouth. And I mean X-rays and whatever under general anesthesia. And to try to explain this, use pictures, use horrible pictures. I think it helps. For example, I like these ones, okay, of a healthy cat and a kind of advanced periodontal disease where you have bone loss, furcation exposed, tooth loss. It helps, you know, because it's really easier to see something and recognize than to listen to many words. That's why I put a lot of images in my lectures. And then communication. So communication means many things. I think that what it is important is to build trust and not to be judgmental. So you explain your findings, okay, while you're doing the examination. Owners really like that, unless you're too busy trying to avoid being bitten. And then you offer different options, and for each option, explain pros and cons, and encourage the owner to ask questions. The thing is that periodontitis is a chronic condition. If you build trust, you have a disease that needs to be taken care of until the very end. I don't want to sound, you know, but it's part of our job. Is also a business, and chronic conditions are the one that bring the patient back to you if you do the right step. And in the end, behave like a human dentist, okay? Because in the end, they deserve the same care. I mean, they have dresses and they have groomers that are hairdressers, and I think they deserve a proper dental care. And it doesn't matter if you don't have a CBCT or a facility like that, that is a specialist, environment. What matters is to communicate, and if you focus on prevention, you don't need all that fancy stuff, You need to be able to talk, to explain, and to do a perfect professional dental cleaning. Okay, a perfect professional dental cleaning. So a perfect professional dental cleaning means to clean above the gum line and below the gum line, okay? Not the crown. We don't really care very much about the calculus that is on the crown. That is not a problem. That's aesthetic, and of course we want to deal with that part as well. But what we need is to remove everything that is in the gingival sulcus, because we know that is there that the bad things happen. Okay, so let's say that in absence of home oral care, you should see your patient every 6 to 12 months. Okay, and we will go through the steps of the procedures, but that is definitely a way of, okay, cannot be sure 100%, but of keeping those teeth healthy lifelong. I mean, pets do not live 80 years. So if you have lesions, that doesn't mean that you need to extract the teeth, okay? An indication for extraction is when you lose more than 40% of the attachment, okay? But if you have pockets, you need to clean those pockets. And then, as I was telling you before, you get a scar and you keep those pockets really clean, or you perform a gingivectomy to reduce the depth of the pockets, and you can save those teeth. So when you have pockets that are less, let's say, dog, okay, because in a cat it doesn't make any sense, but you do the due proportions, less than 4 millimeters, you are required to perform a subgingival scaling and root planning. Okay, that's the word. That means that with your tip of your scaler, of course, a subgingival tip, you clean the pocket, and then you change the tip and you clean the root surface, and that is called scaling and root planning, SRP, okay? While scaling and polishing is the professional prophylaxis. What do you use? I think you all have a ultrasonic scaler. My recommendation, buy different tips, okay? Different tips for different locations. So you start with a supragingival tip and you remove the calculus that is on the crown. You need to use a lot of water, otherwise the scaler doesn't work. And of course, it gets messy. If you have somebody helping you, of course, you can have suction. Otherwise, you just let the water drain But without water, the scaler does not work because ultrasounds need water to be transmitted to the tooth surface. Okay? Then you change the tip. Every time that you need to access the so-called difficult to reach areas or places, you need a tip to get in there. It's not that you need 100 tips, you need maybe 4 or 5. And one very important one is the diamond tip, because it allows you to clean the pocket and also to do the root planning at the same time, because it's levigating the root surface. And when you cannot see, like distally to the 10th, to the last molar in the dog, that usually there is the mandible, and so you cannot really see there, you need to learn how to use a mirror, because that makes the difference. And you will see how much stuff is left behind from before. And then you rinse, and then you blow air, because blow air dries the tooth surface and makes the calculus remnants visible. And then you can go there and finish your perfect job of scaling. And then we go to polishing. Polishing is not what we usually do. Let's be honest. Most of the time we don't polish, and if we do, we just do a little bit on the crown, and paste goes everywhere, probably not where it's supposed to go. And if the cup or the brush goes on the gum, it really irritates and harms the gum. But still, polishing, it's important, okay? Polishing, it's important because the surface becomes not only clean, but smooth. It's like, you know, those glasses in the shower where you don't get the calculus because the water runs away? Okay, that's it. So if you want your result to, you know, persist and be there in time, you need to polish. I have a suggestion. I don't know what your equipment is, but if you have a dental unit, because of course, unfortunately, you need a dental unit, try this, okay? If you want information on how to get, how to buy, I think you have Alibaba in the UK. I don't know what's the relationship at the moment between UK and China, but good relationship with China always help, because you can buy amazing stuff at the very, very good prices. Okay, it's called air polishing. It's a kind of sand blaster that uses a mix of air, water, and this specific powder that has a that are very, very, very micro granules, and it removes soft calculus, plaque, and disrupts the biofilm, and cleans below the, you can clean the pocket, you know, below the gum line. It takes kind of few seconds to do the whole mouth. You reach all the difficult areas, and it is not harmful. For example, if you have like this is enamel hypoplasia or hypomineralization, and you don't want to use a scaler on these teeth, okay? So maybe it could be a suggestion for an upgrade in the future. And then it comes to the conclusion, okay? So you've done an amazing job, and the owner is really happy because the teeth are clean if they are still there. But we are talking about prevention. We are talking about, prevent the periodontitis. But you've done only a part of the job. What I always tell owners is now the difficult part starts, because everything needs to be done every day at home, because their teeth are like ours. We brush every day, 2-3 times a day, hopefully. And unfortunately, you have to do the same. And as I told you, offer options, okay? Because if you recommend to the owner of a cat that is a tiger to go home and brush the teeth, it's a lost cause, okay? And options are toothbrush, gauzes, rinses. You can use chlorhexidine for short periods, alternate with rinses without chlorhexidine, and supplements, and what I call gymnastic, because we always forget that muscles and bones and gums need to be exercised as well. Not with a tennis ball, of course, but for example, with a big chunk of chicken breast. And here everything is really easy because the biggest dog is kind of 6 kilograms, so you can recommend them to shred the chicken breast and make these long pieces so that the dog cannot swallow and has to chew, and teach them to chew, because our pets were not taught by their mothers to chew, okay? And the next time we will talk about the links, always periodontal medicine, between the periodontal disease, the chronic condition, how they affect each other, and how to treat the patient that are at the very end stage, both of the periodontal disease or systemic conditions. So thank you for your attention, and let me know, Julie, if there are questions. I
Yes,
need to
thank you very
think.
much. That was fantastic, Dr. Bonello. Thank you so, so much. Lots of really practical tips in there. So thank you very much for the session. So if anyone does have any questions, you can put them into the Q&A box below. We do have a couple in already, so we'll just get started on questions. So the first one we have here is from Irma. This is quite a big issue in the UK. I'm not sure if it's something you're facing in Hong Kong as well, Dea, but just to ask about this. So she wanted to ask, how do you deal with groomers who offer teeth cleaning services? Many dog owners, as you mentioned, are afraid of anaesthesia or want to avoid the higher vet costs, so they end up choosing these groomers instead. So any
So
ideas?
I moved to Hong Kong in 2022, but that was a huge issue in Italy as well. And I've been working 2 years as a locum in the UK. So yes, the idea, as I mentioned, they are scared about anesthesia, okay? And a little bit is also because sometimes we are scared, okay, of anesthesia, and we pass that feeling, and we don't want to push because then we think, I don't want to jinx it. But there is a way. they can go to their groomer. So always start the conversation in an assertive way. Okay, so yeah, good thing. Can you explain to me how your groomer does that? Because just to make sure that it does the right things, otherwise maybe you can change groomer and get a better one to get a better job done. And sometimes they tell you, oh, I don't know because I'm not there. And then you can ask, if you're not there, you don't really know what's happening in there. How can you trust it? I mean, blindly. So what I recommend is start from the idea that a groomer is a professional, but of course is not a vet. So maybe the best way of doing that is to do a cohat. That means, yes, anesthesia. It means imaging. It means diagnosis. It means professional scaling and polish. And then you can use the groomer as a way of maintenance, but you promise that you come back for revisit so I can check on your groomer's job. The thing is that if you start telling them that is a total nonsense, that it's not a job that is done properly, because it's not at all, 99% of times they keep doing that. So what you need to do is not to shut them out, and try to understand why they are scared of the anesthesia or of the cost, or, I mean, try to understand what the problem is there and deal with that. Change the conversation. Okay? This is what I do. Sometimes it works, sometimes it doesn't. In the past, I was younger, more black and white. I wrote article on that thing and on that topic, sorry. But I realized that it's not by, you know, stepping on the pedestal and saying it's all wrong and I'm doing it right, that you really get their attention. At least this is my experience.
No, that's really helpful. A really different way of looking at that. That's really helpful. Thank you. Thank you. Just a quick one here from Claire Smith. Regarding the chicken breast, would you recommend raw or cooked?
Oh, I never recommend raw. Never.
Easy enough, that one then. Another one here. What do you think of TD diets and things like dental chews?
I don't know if I can go public with my ideas in a webinar that is recorded.
Okay, that's fine.
So I changed the topic of the conversation, okay?
Okay.
GI tract is of carnivores is really, really different from ours. And the oral cavity is the beginning of the GI tract. So, as I told you before, there is a way of classify the taxonomic classification of animals, of species in general, is made looking at many factors, also at the teeth. Okay, so you are in the family of Canides if you have certain teeth. Okay, and rodents are others, and lagomorphs are others, and so on. So if those teeth are made, let's talk of a cat, okay, are made to catch a rat or a small bird and kill and eat that. Eat that thing that is fibers, yes, but nothing of vegetal origin. And 80% water, because this is what we are, 70, 80% water. Nowadays, maybe more because we drink a lot during the day. And there are bones, but they are small bones because the prey is commiserate to the predator. Okay, so a cat is not eating, I don't know, a calf is eating a mouse or rat, and then interiors and then whatever. So not talking from a nutritional point of view. That's not my job. I don't know anything about that. But if you talk about teeth health, that's my answer.
Thank you very much. That's great. Thank you. Next one we have here. I want to ask when to use carets and when scaler when we have a pocket. When should we not be using a scaler under the gingiva, and it's better to choose a curette?
What I'm suggesting you to try at least, if you have an ultrasonic scaler nowadays, except really rare occasions, you don't really need a curette, okay? You need to change the tip. And if compared to the manual job done with the curette, you do a way better job. But if you cannot do that, then curettes are made for, yes, cleaning the periodontal pocket and do the root planning. Remember that when you clean a periodontal pocket, you need to remove the infected tissue, of course, carefully, that is inside, that is lining the pocket on the gingival side, and also to remove the calculus and the debris on the cement surface of the root. Okay, so the scaler needs to be used in both directions. The scaler usually have only one cutting face, and usually that face is against the tooth.
Perfect.
But make sure that you also clean from the debris of the soft tissues.
Perfect. Thank you. That's ideal. So if we've got time, we'll just squeeze in one more here. Is ear polishing used in human dentistry? If not, why not? Just a curious point
Is
here.
the most common way to do scaling and polishing, because then it's also polishing in human dentistry. Yes, there are machines for human dentistry that have the ultrasonic scaler and the air polisher. If you look on a website and you type woodpecker, you see examples of those. They are pretty expensive, so some dentists maybe, and also the powder can be maybe more expensive, but not more expensive than the paste that we actually use. But yes, it's absolutely, and it's human dentists, they started using 15 years ago. I mean, it's not something new. But it's my personal kind of mission to try to bring this into the veterinary profession, because it's going to change your life.
Brilliant. Thank you very much. Well, thank you very much, everyone, for coming tonight. Thank you so much to Dr. Bonello. That was a great session. Thank you so much.
Thank you to you all.
I will send out the recording next week. So if you've missed anything, you can look back, and we have our next session next month as well. So thank you very much for coming, and have a great evening, or I think night for you, Dr. Bonello.
Yeah, looks like more or less everybody is sleeping here. Yes.
Well, thank you
But
so much for your time.
it's a nice view. It's a nice view.
Right. Thank you so much, and take care. Bye bye for now. Bye bye.
Very